What is wellness? It's much talked about, but somewhat vaguely defined. Where do you even start when somebody asks you about what is wellness?
Well, I think you said it well. There isn't really one recognized or accepted definition. And the fact is, it's an evolving concept, which makes it super exciting. But there's a couple of definitions along the way that I've often referred to. One is an older one from the Lancet Journal in 2009. And that was from Dr. Jane Lemaire, one of our Canadian pioneers in wellness. And what she suggested as part of that article is that when we think about physician wellness, it's more than just the absence of illness, that it's really about physicians and learners thriving and succeeding both in their professional lives, but also in their personal lives. I really like that kind of basic approach. But one that has come later that is a bit more comprehensive is one that we find in the Canadian Medical Association's policy on physician health and wellness. And in that definition, what you see is emphasis on, we're talking about acute and chronic illness. We're talking about prevention and treatment. We're talking about making links to social, to spiritual, to physical dimensions. It highlights kind of a risk management approach and also a bit of an occupational health and safety lens. So that definition I found is much more comprehensive and brings in different elements of wellness. But maybe one key or nugget to remember when we talk about physician health and wellness, I would say it's to remember that it's an occupational hazard. Physician wellness is something that we need to think about in that context of workplace, of work conditions. And fact is, anyone working in healthcare, no matter what profession you're in, within it, is at risk because of the nature of the work. So those are the types of things as we relate to the concept. But what's interesting, we're saying, hey, this is a field that's evolving. I love to think about how that concept of physician wellness relates to different models or different frameworks that are out there already. And if I can mention a few, one of them is the triple aim. Now, some of you may not have heard about that, but the triple aim is really a performance measure that healthcare organizations use. It was proposed, I think, by IHI way back in 2007. And what the triple aim talks about is the combination of healthcare outcomes, of cost to the system, but then of patient experience. So that's how organizations were measuring their performance. But with more research linking clinician wellness with things like patient experience and health outcomes, they decided to add another component to the model, and then it evolved into what we hear more recently, that quadruple aim principle. And I think that was so important to highlight the importance of not just well-being of clinicians, but just that fulfillment, the piece where they feel that there's meaning in their work, that they're supported to do their work in treating and helping patients. So I think that was excellent. And that has now evolved even further, Jordan, you may know, into the quintuple aim, because we've now added health equity, which again, we know it really does feed in and improve those outcomes. So that's one model that connects to physician wellness. The other model is the Stanford model of professional fulfillment. So it's interesting here. So they're connecting wellness to professional fulfillment. But the way they design their model is to say, for any organization that wants to improve physician wellness or staff wellness, you have to make sure that you provide a culture of wellness. That's one piece. Also, you have to make sure that there's support for individual resiliency. That's another. But the third one that's important is the workplace efficiency or efficiency of practice. And all of those three components go into enhancing professional fulfillment. So what's really interesting is when they've tried to tie in these different components with research to see what affects what they found is it's really through efficiency of practice that we can get the most benefit for wellness and professional fulfillment. So it tells us that that's where we need to start working if we want to improve wellness. So that's a model that some people are familiar with. And more recently, models such as Joy in Work, again, proposed by IHI, that is a white paper that proposes steps for organizations to take. Again, same idea that joy in work isn't necessarily the absence of burnout, but is really an approach that emphasizes the meaning at work, compassion at work, and the importance of support of the workforce in order to give, again, the best patient care possible. And the last piece I'll mention here, as we're talking about different concepts and how to position physician wellness, is the model of occupational health and safety, workforce health and safety, and that applies to healthcare also. And so it's that mandate to really examine the risk factors, what are the hazards in the workplace, to ensure that all the workers can be at the best of their scope, and do the job that they need to do. So I think that is a more recent lens that I'm finding very intriguing, and I think that applies really well to this concept of physician wellness.
So it very much relates to work and is a risk factor of the medical work environment, but there's a lot more going on there than just being the antonym to burnout, I guess. You mentioned a little bit about how the clinician is feeling, but also like the impacts downstream towards patients or even the team. Could you expand a little more on why focusing on wellness is so important? What is the other side of that coin when you're feeling unwell or burnt out, or however else you like to actually measure that?
Yeah, well, that's a great question. And, the start to that is to say one of the reasons why it's important is because the prevalence rates of the burnout piece is so high. And that's how we started talking about wellness, or burnout as a burning platform, or as almost an epidemic, just because of the rates that were coming out as 50% or higher burnout rates. And that's when it compared to the general population, it was higher, or compared to other really challenging professions, it was higher. So that was like the first hint that there was something important to look at. But why is physician wellness important? It's because of the impact, as you've mentioned. If you just think of the impact on the individual physician, well, this is major suffering. They're suffering from stress, distress, burnout, which then makes them at risk to develop a continuum of different mental health and health issues, physical ones as well. But mental health, meaning anxiety symptoms, mood symptoms, substance use disorders, and really the worst case scenario, which is really tragic, is death by suicide. And of course, this all impacts their immediate family. So the individual physician is definitely impacted. But what's also interesting to consider is the impact that it has on patient care. So the research has now clearly linked physician burnout on decreased patient satisfaction, decreased patient care. It increases the risk of medical errors. It increases disruptive behavior. So if you examine just that piece, what it tells us is essentially physician wellness is a quality and safety issue, because it is directly linked or impacts physician care, or patient care, and also the risk of errors. But the other really interesting piece is how this all translates into cost to the system. So if you think of decreased productivity or issues with retention, when you think about just the cost of replacing a new physician in the system, all of that risk of or impact of medical errors, all of that translates into cost within the healthcare system. In the States, actually, they did a study. This is hard to study, actually, but they did it. And they estimated that in the US, when there were burned out or unwell physicians working, it led to a cost of $4.6 billion per year, because of what we talked about, decreased productivity, retention, and so on. So that means we can also talk about physician wellness as a health system economics issue, as well as we said, an issue that is really close to safety, quality safety. And as we've said, it's an occupational hazard.
I'm Dr. Jordan Valrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.